We thought you had a heart attack and a heart failure during the procedure.
Dr. Iselma Fergus is the head of cardiology at Harlem Hospital Center. She sees it, the devastating impact of stress, poverty, and sometimes access. Dr. Fergus believes all are key factors in explaining why blacks face a number of health disparities when compared to whites. Blacks are more likely than whites to die from cancer, strokes, asthma, and heart disease. This is why Dr. Fergus also believes it's important to reach out to the community on a street level with health fairs like this one.
There are trust issues where we have some of the patients really do not feel like they can trust an institution to carry out the right testing. There are issues with discrimination in terms of language, socioeconomic barriers. So I think we have to look at it from another aspect, coming out into the community where they live, work, and play.
Harvard economist Roland Fryer agrees, but he argues that those disparities don't fully explain why blacks don't live as long as whites. On average, blacks die about 5 years earlier. Fryer believes the answer may actually lie in the twisted legacy of slavery and the grueling transatlantic voyage, or Middle Passage, of black slaves brought to America.
I was in Switzerland, and I'm reading this book, this history book, and there's this beautiful illustration of a slave trader licking the cheek of a potential slave to get on the boat. And I thought for a minute, what the heck is he doing? And then it occurred to me that he might actually be trying to check the saltiness of the potential slave's skin to see if he could actually make the voyage across the Middle Passage.
What does salt have to do with being able to make the voyage?
If you're very salt sensitive, it means you hold on to your salt and you can live in conditions of very hot, very humid, little water. Right? So being salt sensitive is great for long boat rides in horrible conditions, absolutely terrible for hypertension. And that's the irony in this.
The people who could best survive a slave voyage to America are going to, generations later, be some of the people who are most likely to get hypertension.
Absolutely, and that's a theory that's out there.
Many doctors and researchers say the problem with the salt sensitivity theory is that there isn't any medical proof to support it, arguing that chronic diseases like hypertension and heart disease are just too complicated to write off to genetic predisposition. But Fryer sees the possibility of a powerful genetic link. What he's saying is that blacks in America may actually be biologically different than whites. It's a controversial idea, to say the least.
I don't care what the answers look like. If it's salt sensitivity, and I can show that if we eliminated salt sensitivity, if I can show that, and I can decrease the life expectancy gap by half, I don't care if the answer makes people uncomfortable.
Do you worry about rubbing people the wrong way? Angering people, maybe saying things that aren't particularly politically correct?
Absolutely not.
Not a little?
Not a little.
How are you doing? Well, you look good.
Oh, I feel much better.
You look much better. A few weeks after we met her in the hospital, Miss Abdullah invites me to her Harlem neighborhood. She was feeling better, but still struggling. One of the things you said when we were in the hospital, when you were there and I was visiting, one of the things you said was the stress of sort of all the pressure on you really affects your health. What did you mean by that?
Well, just look. I mean, there's nowhere to do anything. I mean, the supermarkets are just lousy.
Poor neighborhoods, poor choices. Simply finding, let alone affording, healthy food is a constant challenge in many black communities.
I have a question for you. How does it feel to be black in America?
It's a concern radio talk show host Michael Basin says he hears often from his listeners.
This woman said on the program recently she can find a gun in her neighborhood faster than she can find a tomato. Isn't that something? And you know it's true. And that's a real issue when you can't eat healthy. Food is your medicine. We're not taking our medicine every day.
For me to go to buy a tomato or vegetables in general, I have to go to 110th Street and Broad.
So a solid 20 some odd blocks.
Or better, because I have to go up and then down. And it's expensive, but it's worth me going there. But then I have to take a cab or take the bus there and the cab back.
How long does that take?
If I took the bus, it would take me maybe 35 to 40 minutes to get there, and I would have to take a cab back.
So you're telling me it would take you an hour total time
Approximately.
to buy a fresh tomato in middle New York City?
Yes, in Harlem.
And in many other urban centers in this country. Whether it's access to fresh vegetables or basic health care, many in Black America are struggling, hurting, and dying too soon.